Hi everyone, Dr. G over here, and today we're gonna have dynamic talks on a very, very important topic that I'm very passionate about and that I've talked about before, but I've never had the opportunity to bring in here a first-time mom. So this time I'm bringing Ailen. Welcome, Ailen.
Thank you. Thank you for having me.
Of course,
The pleasure.
So I want to say a little bit of the background story. So Ailen reached out to me and said that she wanted to share her story because a lot of her friends, a lot of people were reaching out to her and texting her, asking for questions, concerns, because she just became a new mom. How old is the baby now?
He's gonna be 3 months, very soon.
Yeah, so a newborn. So I thought this was a great idea because I know there's a lot of new moms, second-time moms, third-time moms, women that are anxious to be moms, right? So I thought this was like a very important topic to talk about, not only postpartum, like what happens after giving birth in terms of like changes in your mood and emotions, feeling down, anxious, but also during pregnancy, right? So tell me a little bit of how was the process for you?
First of all, I have ADHD, so that complicated even more because I couldn't take my medication during pregnancy, and even now postpartum I can't. You know, like the medication that is
through the breast
milk,
right?
and it passes through the baby, and you have to manage being a mom, to be mom when I was pregnant, being successful at work, perform well, because society doesn't it's not very accommodating to pregnant people and moms. So I had to be on top of feeling bad, nausea, feeling like my body was like a wheel,
Standing.
heavy, and then on top of that, having to perform, and that's something that we don't talk about a lot. That you still have to get up every morning and do whatever you have to do.
And go to work and perform and do the same duties and, come home and also perform,
And prepare for a baby, because that's part of it. You have to have everything ready. You have to buy things. You have to prepare their nursery if they're going to have one. So everything is part of that process. Is exhausting. And then everyone says, sleep now because you will not sleep later. But how can you sleep?
Right.
Having a big bed like that, having all those things.
You get uncomfortable, right? Because you cannot always sleep how you want to sleep, but you're tired. So it's like, I'm tired, I want to sleep, but I can't find that comfortable position, right? On top of, I know that you gotta use the restroom and the bathroom a lot.
Every 3 hours. So I think that's part of the nature preparing you to wake up every 2-3 hours to nurse a baby. So that kind of 2 months before giving birth, you have to get up. So even if you want to sleep, you can't.
Right. So tell me a little bit about how was the process of you, the 9 months prior to have baby. How was that for you? How do you feel the first trimester, and how was the second and the third?
Every trimester is a new challenge. When you think that you are good, that the bad thing just are over, then something else comes. Every trimester is something new. You have to be on your best self, in the sense of taking care of yourself every month, because that's just very important mentally and physically. So I was very sick the first 3 months. On top of that, I have POTS, so had to be on top of that as well. So when you have already any health condition, they tend to get worse during pregnancy. It's very rare that you get better or you feel better. So it's hard on the body and the mind. But I just took care of myself. Took one day at a time, and you're this is a temporary thing. It's gonna pass. It's not gonna last forever. So while you are it, just be sure to do whatever you can to make it as easier on you as possible.
It's just because obviously we're all different, so we're all unique. So some women experience a very smooth transition, it's very easy for them. Some others don't. So we gotta work with what we have and try to make the best of it, because at the end of the day, being pregnant and bringing a child into this world, it's our choice, right? So we're making that choice of carrying life with us. So we know that, of course, it is gonna have responsibilities, changes in our lifestyle, but it is part of the process.
It is.
Right.
You have to see the positive way.
Right. So how has it been after giving birth? Do you have vaginal delivery? Was it a C-section? How was the recovery process? How is it now?
Well, I was planning on having a natural delivery. That was something I wanted to do. And I'm someone that likes to stick to the plan. I'm very bad with flexibility.
Last minute changes.
I don't like that. I like to have the control of things. So I wanted to have a vaginal delivery. It was very important to me, because I didn't want to go through the C-section recovery thing. I knew it was kind of hard.
Longer recovery.
So I was induced. That was not part of plan either, but that happened, and we have to kind of go with medical evaluation.
Yeah.
So after 30 hours of labor, 2 hours of pushing without an epidural because they had to remove it, I had to end up in a C-section at last minute. So everything that I did not want to do happened. And that's something that new moms or moms to be have to keep in mind. Everything is not gonna go the way you planned, and you have to be prepared for
Any last minute change.
yeah, and be okay with that, because that can be a toll on you after that.
Mentally,
How
emotionally.
I wanted the birth and it did not come the way you wanted, and then you kind of feel like not regret, but kind of feel like I missed the birth I didn't have, kind of, because you in your mind it wanted to do away and it didn't happen. So that was hard for sure on the body, because all the
And on the mind, on you as well, emotionally.
and then the first 3 days are the worst. I think for either birth or C-section, because you don't sleep, either because your body aches, you're in pain, your baby needs you every 2 hours to eat, and you just are in the hospital, and the nurses are like every 5 minutes, so like checking on you. So it is very, very exhausting, like mentally. But I think all the rush from like the hormones and the adrenaline you went through keeps you sane
Right.
during
Keep
that
going.
time. Keep you going. You're like, I don't know how I'm still awake.
You're like an autopilot. You just like keep on going.
I asked my boyfriend after like the third day in the hospital, like, how long can you go without sleep, without like before you start hallucinating? Because it's just like so long, and you're like, how can I still be awake after all this time? So that's for sure very hard. And then like me, like I told you, I think I had a little bit of anxiety once I gave birth. I didn't want anyone to touch my baby. I didn't want anyone to care for my baby. I was like, I need me and my boyfriend need the only ones to care for him. And we both were exhausted. So that's for sure was a challenge too.
Right. And it happens, like we don't talk about it enough, but it's not only about postpartum depression, right? There's a lot of, like I've always mentioned before, there's a lot of changes in terms of hormones, like fluctuation, drops of hormones, right? Like changes, lifestyle changes as well. So it's a combination of environmental factors with like, physiological factors. And then it's very, very important that we have support. Like I always say, like it's not only about, just going through the process, but having the support and the social support that is so important for the aftercare. That unfortunately not everyone has social support, but it helps. It helps a lot. I know that, like Ailen was mentioning, sometimes you do have the support, but you're still so anxious because it's a first-time mom and you're so afraid that, anything could go wrong, and you want to do everything like by the book and, like read everything, like the instructions like 3 and 5 times and make sure that you're doing every little detail, right? But when do you realize that, okay, maybe I should allow my mom or like, my family, my friends to help me?
I think there is a point after you give birth around like the 4th or 5th day, then I think that's called like baby blues. You correct me if I'm wrong, that your hormones just take over and I broke down. I was like just crying, and I was thinking I was doing everything wrong, that like nothing was coming on the way I wanted it. And it was just those thoughts like just built up on me, because my baby was not gaining weight the way like, I wanted him to, and I was breastfeeding. So I feel like I was a failure, that I couldn't like nourish my baby enough. So, the pediatrician said you have to, complement, give him either formula or more breast milk because he's losing weight. So that on a new mom is just that basic telling her you're failing.
Yeah, you're not doing a good job.
You're not.
Like, what are you doing?
Yeah. So you
feel judged. Like,
I was like crying. I went on the appointment. I was like, just like, what am I doing? Like, I'm not enough. I'm not, producing enough. So I just broke out, and just being tired, not eating good enough because you're just like so anxious all the time. You are not even hungry. So at that point, I had a conversation with my boyfriend. He said like, you have to accept help. Like, we cannot continue this way because I'm exhausted. You're exhausted. It's not gonna be good for your milk production. It's not gonna be for the baby.
Exactly.
That's not helping you. You have to let us like
receive the help that we've been offered.
Yeah, like as long as you just tell us your limits, so where you're comfortable with, and then we will slowly like try to help.
Right.
So that's how after like the fifth day I start receiving
Slowly transitioning,
but
right?
even then it was just like in a few times like it was like, but that's when I kind of accepted
Right.
it, but it took like that point.
Yeah. And I'm glad that you mentioned the postpartum blues because I talk about postpartum depression, but I haven't mentioned postpartum blues. And postpartum blues are common, they're normal, it happens to everybody. And it just happens, like you mentioned, usually within 7 days of giving birth, right? So it's because there's that sudden, abrupt change in hormones, right? You start feeling like very sensitive, like you want to cry, like you're not doing a good job, like you're like overwhelmed. On top, of course, you're a new mom. You gotta feed a newborn every 2 hours. You gotta change the newborn, right? So those feelings are normal. But then if that goes on beyond a week and you continue to feel down, depressed, irritable, right? Like things are bothering you, then you should definitely ask for help because then we're past that normal period of, the blues. The blues go away and they go away on their own, right? Depression is something that it stays longer and affects your mood. It affects how you're like caring and helping your child, but not only your child, but you also interactions with your boyfriend, your husband, your fiance, your partner, right? Your family, your friends. You start to get like, isolating yourself, but at the same time knowing that you're perhaps not doing like the things or the care that you wanted to do because you're not emotionally there, right? And that's one thing. And the other thing is anxiety, right? Of course, if you're a first-time mom, especially for first-time moms, there's a lot of anxiety because there's a lot of unknown. The whole process is unknown. It's uncharted territory, like I said. Everything is unknown. You haven't been there. You haven't experienced that. Everything's gonna be a first-time experience.